also fortunate to have three other guests here with us to talk about the ACC's advocacy efforts. We have Dr. John Harold. John is from the Cedars-Sinai Medical Center in California. John's the current governor of the board of directors. Is that right? Of the board of governors?
Chair.
Okay.
Board of governors.
And next to John, we have Dr. Thad Waits. Thad is currently Thad, you're at the Southern Heart Center in Mississippi, is that right?
Right, Hattiesburg, Mississippi.
And you're gonna be the incoming chair-elect, is that right?
That's correct.
Okay. And then down besides Thad is Dr. Richard Kovacs. Dick is the professor of clinical medicine at the Krannert Institute of Cardiology. And Dick, I think in just a day or so, you're going to be the chair. Is that correct?
I replaced John on Monday night.
Congratulations, to both of you, for you and you. And let me ask you, I don't think everybody knows the size of the ACC chapters. I mean, how many are there, and sort of what do they do?
Well, we're very proud that there's a chapter now in every state. In addition, there are chapters in Canadian provinces. There are chapters in the public health service and the military services. And there are several international chapters which are growing in the college.
And so it's very sizable. But, what's the role of the chapters? I mean, Thad or John, what do you see as the role of the chapters?
Well, the chapters have focused on three mission areas: advocacy, quality, and education. And over the past 12 months, advocacy has risen to the fore, primarily because of the Medicare changes in the Medicare payment schedule and so on. And it was sort of like awakening a sleeping giant. So the Board of Governors mobilized in all 50 states to really fight this attack on patient access.
This has been a really incredible year, under your leadership. As you look back, what do you think, with the Medicare cuts, the health system reform debate, what do you see has been the biggest challenges or the biggest accomplishments of your year?
I think the biggest accomplishment has been the mobilization of the grassroots. In every state, in every chapter, we've had visits at the local congressional district office with physicians and their patients, talking about what has happened to patient access, the transition of moving private practices to hospital-based employment, and how this has threatened patient access to both quality patient care and also imaging.
So, busy year. Dick, you're the incoming chair. What are you looking to accomplish? I mean, what do you hope to carry on? Obviously, the good work that John's done, but what do you hope to carry on?
I think the most important thing for the Board of Governors, which serves as an advisory board to the Board of Trustees, is to communicate in both directions, both from the grassroots up and from the Board of Trustees and from the college down to the grassroots.
I think that'll be important. Thad, the international chapters, I think that's a neat thing. What do you see is going to be their role? I mean, because they're not directly involved in some of the healthcare system reform, but I mean, what do you see their roles?
Well, one of our chapters is Puerto Rico, and of course they are directly involved.
Sure.
And we have on our steering committee, we have had a governor, the president of the chapter in Puerto Rico, and they're very much involved in all this. The others, they are much more in the educational part of it and not the advocacy part.
Right. And, as you look back at the chapters, sort of what do you see their membership? What should the chapters do, the memberships and the members in the chapter? Like I'm in the Georgia chapter. I mean, what would you see the role of the members in each chapter do?
Well, the members have been the chapters have been the linkage to the membership and to the grassroots. So the Georgia chapter yesterday put on a fabulous Year of the Patient event based on CardioSmart, where individuals from local communities came to the Omni Hotel for health screenings, and there were several hundred patients there. It was all about patient advocacy, prevention, and what the doctor can do to help educate these individuals, and that was a major accomplishment.
I agree. I was there, and it's a phenomenal thing, great thing to get involved. As you look around the spectrum of the chapters, though, are there issues affecting some chapters? I won't pick on California, but let's say California versus Indiana or versus Mississippi. Will there be issues there that would be important to the entire organization?
Well, I think Dick can talk about imaging in Indiana.
Yeah.
Every chapter is unique and provides the membership their vehicle for addressing those local concerns. We have a concern about requirements for pre-certification for something as simple as an echo in your own office. And we're working, because our carrier is different than John's carrier in California, we have to work at the local level to provide the access for the patients without that interference.
So there are a lot of issues. And it's really important for the members of the college to be active in their chapters, isn't it? We've seen that this year, especially. Well, I appreciate all you've done, John, this year.
Thank you.
Dick, I look forward to your year, and Thad, when you come in, I know you'll continue this great work. And we want to thank each of these gentlemen for being with us. And we're going to be back with much more in just a minute, so stay tuned.